It is indeed my pleasure to represent the Ministry of Health and to give you a statistical update on the COVID-19 situation in Barbados. As of January 8th, we conducted 1,400 tests yesterday, and of the 1,400 tests that were conducted, we diagnosed 23 persons with COVID-19, 14 being men and 9 being women. Yesterday, we discharged 30 persons from isolation. However, I have to add that we have 115 tests that are outstanding or pending, and the tests could be pending for more than one reason. Sometimes the tests are positive but haven't been validated, and then there are other reasons for tests being pending, simply not having been conducted. So in total, since March of 2020, we've had 808 cases of COVID-19 in Barbados, 347 of those being female and 461 being men. In terms of the total number of tests conducted, that number is just under 82,000. In terms of the numbers currently in isolation, we are at 428 persons in isolation across various facilities, and Minister Walcott in his opening address would have touched on those facilities. In terms of the clusters that we're looking at the prison, we have 56 staff, or 17% of the staff population being COVID positive, and 137 inmates, or 18% of the inmates being positive. Minister Walcott in his presentation would have mentioned that the second tests that are due for the staff as well as the inmates have been conducted, but we only have preliminary data. When we get definitive data, we will present that tomorrow. In terms of the prison, we have 37 cases associated with this cluster in the community. So when we add the 137 inmates and the 56, that's in the entire population of persons related to the prison, but then they're linked to 37 cases in the community. Related to this outbreak or cluster is the bus crawl, which has 14 cases. And then we have on the West Coast, we have 67 cases in that particular cluster. And I also have to note that there are small clusters that we have not yet fully defined, but there are many small clusters out there contributing to the large outbreak that we experienced just over a week ago. So overall, the numbers are trending down, but we're not out of the woods yet. Vigorous contact tracing efforts continue, and we've made significant headway, but please appreciate that this is a very intense and laborious process, and it's going to take us time to fully outline the clusters and the index cases and to have a solid idea as to how this outbreak started in Barbados that we did not anticipate. I also want to apologize on behalf of the Minister of Health, Lieutenant Colonel Jeffrey Bostick, and the staff of the Ministry of Health for the delays that we've been experiencing. As Minister Walcott would have mentioned, this was a seismic shock to our system. We had systems in place that were working for many, many months, but with this massive outbreak of nearly 200 cases in one day, in one 24-hour period that we detected, it really put a significant strain on our systems. And in some cases, some of our systems that were working before broke down. So we are in the process of building back systems, improving systems, and implementing new systems if necessary.